Hi everyone, my name is Heather Smith and I am going to present my clinical teaching plan. I am going to bring up my PowerPoint so I can go over it while you all see it. Okay, my clinical teaching plan was going to be for Best Care Family Practice in Greensburg, my hometown, and it was about bronchitis treatment. A little bit about Best Care Family Practice, their mission statement, to improve the overall health of the community through comprehensive, compassionate, and cost-effective care, to be an essential and meaningful part of the community, providing the best health care possible, constantly thrive to provide the highest quality of patient care through education, open communication, and personal accountability. And we are privately owned and operated. Needs assessment background, bronchitis. Bronchitis, a respiratory condition, causes the airways of the lungs to swell, produce mucus. 95% caused by a virus. And as you can see, millions of adults each year are diagnosed with acute bronchitis. And not only that, but 9.3 million are diagnosed with chronic bronchitis. $4.4 billion are spent on bronchitis treatment. So it's very important that we spend the money wisely to do the correct treatment. The gap in knowledge. There's a lack of knowledge on how to differentiate bronchitis from other respiratory illnesses. This is not something that's easy to do, no matter how long you've been a provider. There's also a need to educate patients on treatment, which is difficult for most providers. You'll see a lot of patients come in and demand antibiotics and think that's the only way they're going to get better. There's also a gap in the providers not understanding of the fact that we don't utilize antibiotics for bronchitis. And oftentimes you'll see that's the first line of treatment given. So why is bronchitis important for me to go over the treatment with these providers, for me to educate them? Best Care Family Practice serves people of Greene County and also a local nursing home which has 118 residents. The practice is made up of one MD and 2 FNPs. Greene County itself has over 11,000 people and an unemployment rate of 7.9%. Now, it's a very low populated area, but it's also a very low economic status as well. Considering one episode of bronchitis can mean 3 to 4 days of missed work, we need to make sure that we're treating it correctly so it's resolved quickly. 20% of the population is made up of residents over 65 who are more susceptible to respiratory infections. Greene County also has a huge number of smokers. 40% of the population smoke, and smoking is one of the major contributors to development of both acute and chronic bronchitis. Also, 18% of Greene County residents have asthma, which is exacerbated by bronchitis. So it's very important in our community that we get the correct treatment. Description of the learners. The MD has 42 years experience, one NFP with 12 years experience, and one who is a new graduate and also DNP student. The MD is male, both FNPs are female. All 3 are white, English speaking, and ages range from 39 to 71. The goal of learning for the providers of Best Care Family Practice to practice evidence-based treatment of bronchitis. Objectives. By the end of the lesson, learners will be able to list the 3 signs and symptoms for the diagnosis of bronchitis, identify 3 appropriate inhalers for the treatment of bronchitis, and to demonstrate evidence-based decision-making and patient education regarding diagnosis, treatment, and supportive care of bronchitis during a simulated patient encounter. The methods of instruction that I use are PowerPoint and lecture, which we differentiate signs and symptoms of bronchitis versus other common respiratory conditions, review current treatment guidelines, educate on the effects or lack thereof of antibiotics of bronchitis. And the advantage of doing the PowerPoint and lecture is able to give reasoning for treatments other than antibiotics. Another method that I will be using are case studies. And this is where we utilize actual case studies describing various conditions. This is going to act as our patient simulator since we don't have one in the clinic. And learners will be able to demonstrate bronchitis versus other respiratory conditions. An advantage is real-life patient presentations and demonstrate if teaching was effective. I'm going to go over the 4 literature review. The first one was on PowerPoint versus chalk and talk. In other words, your traditional lecture. The purpose is to compare traditional lecture methods with the PowerPoint technology of instruction. The method was cross-sectional descriptive survey, and nursing students were selected for this. The findings was there was an 11% difference in the preference of teaching styles, with traditional lecture being favored over PowerPoint. But the conclusion was that both traditional and PowerPoint presentations are effective forms of teaching. Level of evidence was 6. Our next one is college-based case studies using PowerPoints effectively. The purpose was to examine PowerPoint's potential to enhance traditional practices in higher education. This was qualitative research done through observation of classrooms, both using PowerPoint and lecture. The findings for the PowerPoints, when designed with colors and cartoons that kept attention of students, can keep students interested longer than just a lecture. And the PowerPoint slides should be less than 6 items per slide. The conclusion is that the use of lecture combined with colorful, interesting, and humorous PowerPoint present a highly effective instructional method. And the level of evidence was 5. The next one we have is human patient stimulation versus case study. And this was to evaluate the effectiveness of the 2 teaching strategies. Quasi-experimental method was used, and pre-tests and post-tests were given. The findings were that the pre-test scores were almost identical, but the post-test scores were slightly higher for the case study group. Interestingly enough, though, the instructors were also given clinical evaluations to complete on how they felt the students utilized critical thinking during both these teaching strategies. And even though the post-test scores were slightly higher for case studies, the instructors thought that the students displayed a more critical thinking skills in the human patient simulation. Conclusion is that both teaching strategies are effective, but some students may benefit from the case studies, whereas some more benefit from the human patient simulation. And the level of evidence there was 3. Our last one is preferred methods of learning for nursing students in an online degree program. And the purpose was to determine which teaching strategies students found to be most effective and engaging. The method used was students from 2 accredited private schools were recruited to complete online surveys. The findings overall, the top 2 methods were that were most engaging to the students were PowerPoint presentations and case studies. However, there were differences among the generations. For instance, the baby boomers in Generation X preferred discussion boards over the millennials, who preferred more of the PowerPoints with lecture. The conclusion is that there are distinct differences in preferences among baby boomers, Generation X, and millennials. So to be effective, faculty needs to incorporate several different teaching styles into their lessons. So what does the literature review indicate? The PowerPoint and case studies are both effective methods of instruction. Both forms of instruction must be presented in an engaging manner to be effective. In other words, you can't just throw PowerPoints up there with a bunch of information on them and just read verbatim. You've got to interject some other colorful either anecdotes or facts into there to keep someone's attention. And both of these forms were deemed to be effective across all generations. So why will this be effective for my audience? Straightforward and to the point. We're going to be using statistics from reputable resources, are going to be reviewed on the PowerPoint. Both can be presented in an engaging manner, and both methods are time effective and cost effective. And with these providers in a small clinic, it needs to be time effective. There isn't a whole lot of extra time, so it needs to be straightforward and to the point. Learning theory integration. What I did here was progressivism is the learning theory that I had focused on for my map. And in progressivism, you have education is for a lifetime. You're never too old to learn. This is really important because we have an MD that has been practicing for almost 40 years and another nurse practitioner that's been practicing for over 12 years. So you want to make sure that you're never too old to say, I know it all, because you don't. Focus on the students as a whole. No 2 students are the same. So I'll be teaching people with a lot different backgrounds, even though they work together all the time. They still have different learning styles and different ways of thinking. And learning through hands-on experience. The best way is through real-life examples. So using the PowerPoint and case study, I'm able to give statistics, and the proof is in the numbers, especially for the MD that I will be educating, to have those hard facts there. Both the learning methods reach baby boomers and reach both age groups of the learners. And each style can reach students in a different experience. So if you don't pick up on something in the PowerPoint, you may pick up on it on the case study. And the real life case studies use examples of what has worked and what has failed. So it's not just making up your own situations. It's things that have happened before, either in other doctors' offices or in hospitals. So why is it appropriate for my audience? Both methods have been proven effective across multi-generations. They're able to be presented in engaging manners, allow the information to be presented in 2 different ways. They're able to use facts incorporated into a lesson, which is really important for the already established providers. And both methods can be tailored to be time effective, which is very important when you have providers that are seeing 20 and 30 a day. So for our first objective, listing the 3 signs and symptoms for the diagnosis of bronchitis, we want to do a pre-test, just a few question that would take less than 5 minutes, just to establish if they can differentiate between bronchitis and other respiratory issues. Then we're going to use the PowerPoint to give a background on bronchitis, including the signs, symptoms, and pathogens. We're going to have little cartoons along the way and little animations. PowerPoint instruction utilizing tables comparing bronchitis, allergic rhinitis, pneumonia, and upper respiratory infection. It's really important to have them side by side so you can differentiate one from the other. It's a little bit easier learning that way. And also there's a YouTube video with graphics. Then we'll do a post-test to make sure that the teaching was effective, to see if there's anything we need to go back over. And again, these pre- and post-tests are nothing that are long. Second objective was to identify 3 appropriate inhalers for bronchitis. So we're going to use the PowerPoint to review the inhalers in our classes and also to educate on the best treatments for bronchitis. Then we're going to review how these inhalers work on the respiratory system and how long each inhaler should be used and how many times daily. We're going to do a post-test to demonstrate effectiveness of teaching. Our third objective is to demonstrate evidence-based decision-making and patient education regarding diagnosis, treatment, and supportive care of bronchitis during a simulated patient encounter. So we're going to use a PowerPoint to review current evidence-supported treatment guidelines for bronchitis. Then we're going to review 4 case studies, 2 to show the effectiveness of inhalers and 2 to show how ineffective the antibiotics were. 2 in these case studies, see how the providers handled educating the patients on the different courses of treatment and how we can best do that. We're going to have an open discussion on how this can be integrated into our practice, and then a post-test based on additional case studies to determine if providers chose the correct course of treatment based on the guidelines. In order to evaluate these teachings, we're going to have 2 parts. The first is a 4-question evaluation that's just simply yes or no. So gets our did they feel prior to the lesson they had good understanding of bronchitis? Do you feel the material presented was done in an engaging manner? And do you feel the lesson gave valuable information to use in practice? And do you now feel that you have a better understanding of bronchitis? These are just yes or no, if they thought they were, and then if they thought they had a better one afterwards. Then we're going to have 2 quick fill-in-the-blank questions to give feedback as to improvements, how you could feel this lesson could be made better, and to name one thing that you learned from the lesson. You want to know that your audience has learned something from what you're trying to teach them. This is the additional resources we would use for teaching. There is a YouTube video on bronchitis or pneumonia that's really good about how to tell the difference. We're going to use the OIE clinical guidelines of primary care to go over our clinical guidelines for treatment of bronchitis. And then for case studies, there is a National Center for Case Study Teaching in Science that has some great case studies on bronchitis that we use. This is just use, and it's in what you are. In other words, you can never stop learning. So I have a MD that's been doing this for decades, but if you think you've mastered everything, that's when you need to stop. You always need to continue learning. We can always learn something new. And then, oops, sorry, these are my references. Thank you for listening.